So it's about time to start now. Distinguished participants, I would like to welcome you to today's webinar uh, on titled Hypertension and You, Diet and Lifestyle Choices for a Healthy Heart. The webinar is a maiden edition of an African-wide webinar series that will be hosted by the Nutrition, Agriculture and Health Initiative. Africa faces a complex mix of non-communicable diseases, of malnutrition and food insecurity. And the burden of non-communicable disease is really rising. So despite growing awareness, there remains a gap in accessible, practical, and expert-led discussion on nutrition that cater to different population needs across the life cycle, beginning from the first 1,000 days of life. This calls for a pressing need to bridge this gap with consistent and engaging conversation led by professionals who can provide evidence-based guidance to individuals, family, policymakers, and other stakeholders. In this regard, today's webinar has been organized to commemorate the 20th anniversary celebration of the World Hypertension Day for Global Hypertension Awareness. Every May 17 is World Hypertension Day. For this year, 2025, the theme is Measure Your Blood Pressure Accurately, Control It, Live Longer. To explore our topic today, we have three speakers who will share their knowledge with us and help us debunk some myths, after which we can take some questions from the audience, which our speakers can respond to. I'd like to encourage you to please introduce yourself using the chat features of Zoom. And if you also have questions, kindly type them in the chat box. You will also see in the chat links to follow the Nutrition, Agriculture and Health Initiative social media link, join the WhatsApp channel to stay connected with evidence-based nutrition and health education. For our Francophone audience, one of our speakers, once I introduce him, will help to summarize our discussion in French at the beginning and the end of the webinar. So distinguished participants, I would now like to introduce our first speaker for today, Dr. Mamadou Sisoma, who will talk about hypertension, its causes, symptoms, complications, and management. Dr. Sisoma is a cardiologist and head of the cardiology unit of the Reference Health Center of Commune 2 of Bamako, a position he held since January 2018. He previously served as COVID-19 focal point, is an instructor of various medical courses. You're welcome, Dr. Sisoma. Before you go into your presentation, if you can kindly help us give a brief summary of what I've said so far in French so that our Francophone audience can follow, and then you can proceed with your presentation. Thank you. Over to you.
Thank you very much, Anjurine, Dr. Anjurine. Bonjour à tous les participants. Je m'en vais résumer ce que Dr. Anjurine vient de dire tout de suite en quelques phrases avant de commencer ma présentation en anglais. Donc, bonjour à tous les participants. Merci de nous joindre. Donc, le 17 mai, c'est la journée internationale de l'hypertension artérielle. Donc, c'est une opportunité que cette initiative a saisie. L'initiative s'appelle NAHY, ça veut dire Nutrition, Agriculture and Health Initiative. Ça, c'est en anglais. Donc, c'est les organisateurs de cette initiative. Donc, aujourd'hui, le titre, c'est l'hypertension et vous. L'hypertension et vous. Le régime, les choix du style de vie. Voilà, donc on a dit que parlons hypertension artérielle, avant que l'hypertension artérielle nous parle. Ça veut dire tout simplement de promouvoir la prévention, c'est-à-dire il ne faut pas attendre les complications pour savoir comment se comporter pour éviter l'hypertension artérielle. Donc, tous ceux qui sont intéressés par la prévention, tous ceux qui ont des patients hypertendus, tous ceux qui sont hypertendus voilà, et qui sont curieux de savoir les informations au sujet de l'hypertension, ça, c'est une occasion pour vous. Donc, elle a aussi dit que les réseaux sociaux sont actuellement inondés par beaucoup de personnes qui font des vidéos sur la santé et ils ne sont pas des spécialistes. Donc, cette initiative est venue pour rendre ça un peu plus, voilà, pour que ce soit des vraies informations désormais. Merci, je vais aller vers ma présentation. On a peu de temps.
Thank you.
Thank you.
Merci beaucoup.
De rien. So now I'm getting back to my presentation about hypertension. Okay. Good evening, everybody, all of the participants. Good evening, my fellow speakers, Abiola and Nana Kofi. And I'm going to share what I have prepared for you today about hypertension. So I'm going to start with a definition, followed by the epidemiology, and after I will talk about symptoms, complications, management, and conclusion. So what is hypertension? Hypertension is defined as a systolic blood pressure at 140 millimeter of mercury and more, and or diastolic blood pressure at 90 millimeter of mercury and plus. So the systolic blood pressure is the pressure of the contraction of heart contraction. The diastolic blood pressure is the pressure measured at the rest of the heart, when the heart is resting. So we have two types of hypertension. The first one is the primary hypertension. That's account for almost 90% of hypertensive patients. The second one is secondary hypertension. That's from 5 to 200% of all hypertensive patients. Usually the secondary hypertension is in children. And sometimes, usually, there are many causes behind this type of hypertension. So how to measure your blood pressure? So we have a picture here that shows how to measure the blood pressure. So you must be in the room, calm room, no noise, sitting on the chair. So the arm at the level of the heart and check the blood pressure. And you need 5-10 minutes before checking the pressure. And also you don't have to take tea or coffee before in the last 5 minutes. So you can get an accurate blood pressure. Epidemiology. How bad is hypertension? Hypertension is a silent killer. Why is it a silent killer? According to WHO, high blood pressure is the most prevalent cardiovascular disorder in the world, with 100.28 billion adults aged from 30 to 79 worldwide. the two-thirds living in low-income and middle-income countries. In pregnant women, there is a high risk of maternal and fetal death also. So epidemiology. The prevalence of high blood pressure is around 30 in sub-Saharan Africa. 27% of them are unaware of their condition. So 18% are treated and only 7% are controlled. So the pathophysiology of blood pressure, high blood pressure. So it results from a combination of many factors. So apart from the blood pressure regulation by the body, we have environmental factors. So ambient temperature, noise exposure, air pollution. We have also lifestyle factors, diet, alcohol, smoking, physical activity, sleep quality, and stress. And we have also genetic factors. What are the symptoms of hypertension? So you have to know that more than half of hypertensive patients have no symptom, so they are unaware of their condition. That is a trap. So we need screening for hypertension to have an early diagnosis. And the screening interests people from 18 of age and above. But the symptom may be headache, dizziness, and other. What are the complications of hypertension? It is a major cause of death, occurred generally in undiagnosed patients and uncontrolled patients. Doctors are more or less powerless at this stage. They will do their best to limit the damage, but death can happen very early. About complication, the heart can be a target with heart attack. The brain also can be a target with stroke. The kidney also can be a target with kidney failure. We can have also heart failure and other. How to manage hypertension? We have on one hand drug therapy or medication. On the other hand, lifestyle change, physical activity, diet, weight loss, and other. So medication is for lifetime for primary hypertension. And so for secondary hypertension, if the cause is healed, if the cause can be healed, the result will depend on the healing of the cause of secondary hypertension. I said earlier that's common in children. The lifestyle change will be developed by my fellow speakers. So lifestyle change plus medication will lead to a certain reduction of mortality and complication linked to hypertension. So to conclude, hypertension is the most common cause of cardiovascular death and complication. Most people are aware of their condition. So early diagnosis and proper management decrease undoubtedly negative impact on us. Given the availability of checking devices and doctors, you are invited to choose to live longer and healthier. So this picture is from our district hospital. I took it this morning.
Well,
so the PG student of Cardiology are screening now for hypertension. So thank you very much. Over to you.
Thank you so very much, Dr. Sisoma, for your presentation. In your presentation, you made us know that there can be either primary or secondary causes of hypertension, and you mentioned that like about 90% of hypertension come from the primary hypertension, and that there can be secondary hypertension maybe among children. You also emphasize the accuracy, or I mean, the need for accurate measurements of blood pressure. I think I picked that, for instance, you said before the blood pressure is taken, the person should, be allowed 5 or 10 minutes of rest, and also avoid taking tea or coffee about 5 to 10 minutes into that. You mentioned different things about the causes and all that. Of course, I picked on the measurement part because the theme for this year, World Hypertension, is measure your blood pressure accurately, try to control it, and live longer. And to a large extent, you've given us like a broader overview of how we can manage that. You did mention that we could do either drug or therapy management or lifestyle changes like diet or physical activity. So to take us further, I would like to invite the second speaker for today, Nana Kofi Owusu, who will speak to us on the dietary origin of hypertension. Nana is a registered dietitian, a TV host. I would dare to add to that, a TV host extraordinary, or how is it pronounced now, and a lecturer in Ghana. He is going to speak to us about the dietary, just to continue in the flow of thought that Dr. Suma had established. He will speak to us about dietary origin of hypertension. Over to you, Dietitian One, I must mention, as is fondly called in the media space. Over to you, Dietitian One.
Thank you very much, Dr. Fulake, for your kind introduction, and a very good evening to us all. Thank you very much for your very apt presentation, and I enjoy the French so much. I wish I could speak French like you. Je parle français un peu. So we are continuing the dietary origins of hypertension. It is very key to re-emphasize the role of diet as a predisposing factor, as a link to the cause of hypertension, because apart from the genetic bit, the diet is the next major contributory factor to hypertension. So it's important to know where you are coming from, what is implicating you in getting hypertension from the diet part, because by and large, that you can do something about. So when we talk about dietary origins, we are talking about anything that relates to food intake and its effect that will increase your risk of getting hypertension. That is what we talk about when we're talking about dietary origins. And so from the time that you were conceived in your mother's womb, there are beginnings of the laydowns that can predispose you to getting hypertension, all these cardiovascular or non-communicable disease. So we call something fetal programming. And fetal programming occurs in the womb. So you are not just what you eat, you are what your mother ate. So what you eat can predispose you to hypertension, but more importantly, of the genesis, the origins of it starts from what your mother ate when you were conceived. So there's something called epigenetics, the changes in your genetic layout, in your genetic formations, and what will show forth later on in life is set out by what your mother ate. So going forward, these lifestyle or modifiable risk factors are things you can do something about. They include excessive body weight, excessive sodium intake, inadequate exercise, excessive drinking, smoking, and mental stress. These things you can do something about them. So that's why we're going to deal with them. The first thing is about your weight status, or what we call your nutritional status. So how heavy you are relative to your height is indicated in your risk of getting hypertension, whether you are too big for your height or too big for your stature. Your fat deposit is too much for you. That can, so that's what we call metabolic syndrome, which relates your weight or obesity to insulin resistance, to high blood pressure, and to your lipid levels, your cholesterol levels. So the triangle of disease, when it comes to NCDs, is about obesity, its relativity to hypertension, and to cardiovascular disease risk. So how do you find out whether your weight is okay, whether your weight will make you get hypertension? Body mass index. And everybody under the sound of my voice must do this. Measure your weight in kilograms and divide it by your height in meters squared. That is your BMI. And if you did that and you got between 18.5 and 25, it means you are okay. Your risk is very low. If you got above 25, between 25 and 30, you're overweight. You are increasing your risk. If you got above 30, then you're obese, then your risk is very high. If your BMI is above 40 and you're morbidly obese, then it means that you are at excessive risk. C'est grand risk. Very, very big risk that can give you hypertension. So you must be between the green portion, 18 to 25. Check your status today. Know your number. We are talking about numbers. Apart from knowing your blood pressure, you must also know your BMI. Now we move from body mass index to body composition analysis, which is telling us about your fat deposits, your total body fat, and your visceral fat, the fat around your organs, and then your lean muscle mass. If your lean muscle mass is low, your risk of getting hypertension is high. If your visceral fat is high, your risk of getting hypertension is high. Your total body fat is high, your risk of getting hypertension is high. But then you ask, where is the fat deposited? Where the fat is deposited can even increase your risk. If the fat is deposited on your chest region and your stomach region, your risk of hypertension is very high. So we have the apple shape. If you have the apple shape, you have bulkiness or fat around your chest area, your risk is high. If you have the pear shape where the fat is deposited on your gluteus, your buttocks, and your thighs, your risk is quite low. So be an apple. Don't be be a pear. Don't be an apple. Be a pear. Don't be an apple. So you must know this. The waist circumference is one of the ways to find out. If you push a tape measure around your navel area and it is beyond a certain level, then your risk is very high. Okay, so excessive caloric intake, that shows in high soft drinks intake and high alcohol intake, especially with meal, sedentary lifestyle, high fried foods intake. You are frying everything, frying kose, frying yam, frying plantain, frying fish, frying meat. Everything is fried. Then your calories are going up because 1 gram of fat is going to give you 9 units of energy. 1 gram of carbohydrate will give you 4. 1 gram of protein will give you 4. 1 gram of alcohol will give you 7 units of energy. So the more fried foods you take, the higher your risk of getting hypertension, getting overweight, and then getting indiscriminate snacking. You see this, you take, you see this, you take biscuits, pastries, sweets, refined juices. So look at this picture. Adding soft drinks to your meals is one of the things that can lead to caloric overload and make you overweight. Taking 4-5 bottles of drinks and then lazily changing the channels can give you problem. Look at this. This is fried plantain, and you are even frying the groundnut. Why do you fry groundnut? The yam is fried, the pork is fried, the pepper is fried. Too much fried. And again, when you repeat oils, repeated oil, use the same oil over and over and over, you have trans fats, excessive meat intake, excessive offal. intestines intake can give you high blood cholesterol, which can increase your risk of getting hypertension. Then again, a lot of salt intake, you are adding salt to your swallow, to your bangkun, to your couscous. You are adding salt to your pepper, grounded pepper, to your sauce, to your soup, and then you're adding salt even to the fish when you are frying it. Excessive, so canned fishes, sardines, mackerels, corned beef, a lot of it will raise your salt intake. There's even salt in soft drinks and all those things. So beware of it. Salted fishes will give you problems. So the crux of the origin of hypertension with regards to diet is inflammation. How much inflammation is happening in your system, especially in your blood vessels. So oxidation will lead to free radicals that will affect the integrity or the smoothness of the blood vessels, that can lead to hardening of your blood vessels, that can lead to scar formation of your blood vessels, that can lead to cracks in the blood vessels where fat will accumulate and cause a blockage in the cholesterol, and then you will get high blood pressure. So if you are taking a lot of refined foods, biscuits, bread, and all those things, you are taking high fried foods, then your risk of getting high oxidation is very high. On the flip side is antioxidation, and antioxidation is what you need to offset the oxidation that is going on. So the balance of oxidation so look at this scale. The burgers and the fries and the pizzas are high, so oxidation is high, and the thing that will lead to antioxidation, fruits and vegetables, is low. So then your risk of getting hypertension increases. Vitamin A, vitamin C, vitamin E are the chief antioxidants that we know with regards to vitamins, the selenium and all those things, which are minerals that are also antioxidants. So the more antioxidants, 2 to 3 fruits a day is what the recommendation says that you should take of fruits. Add vegetables to your soups, so that you reduce the risk of getting hypertension. So the time to act is now. We are on a ticking time bomb. Hypertension is killing a lot of people. Don't let your tongue and your lips cause problems for you, lead you to diseases. Let the things that you eat add to your life and give you longevity. Thank you very much for your attention. I'll take some questions later on when they come. Thank you.
Thank you so very much, Dietitian One. Wow. I'm learning a lot myself that you are not just what you eat now, you are what your mother ate. So I need to go back in time and start asking my mother question on what she ate when she was carrying me. or that's really this thing. You also taught us about the importance of weight. You know, the importance of weight in the link with hypertension. And for this, you had mentioned the need to understand our weight status, our nutritional status, what you refer to as weight, and you emphasize the body mass index, the need for us to also measure. Again, we're talking about measurement again. Measure the things that contribute to your blood pressure. So measure your weight in kilogram, you said, and divide it by height in meters squared to know your BMI, and you can by yourself assess and fix yourself on the continuum that you belong to in the range and the classification to know whether you are overweight, obese, and all of that. And you had recommended we should make sure that when we do that, we should be a pair, making sure that our weight is towards the backside and not in the middle region, in the abdominal fat. So be a pear, not an apple. Okay, so I'm going with that. You mentioned the different diets also that can also help address that. Wow, interesting. Salt control and all that. So I also have with me today again another speaker who would further talk about this with us. Dietitian Abiola, if you can stop. Okay, I'm wondering. Oh, okay. So she will, Abiola Ogunwale, she's a dietitian nutritionist with training both in Nigeria and in the UK. And she is going to talk to us today about the role of DASH diets in and blood pressure reduction. Okay, Abiola is based in the UK, and she currently works within the NHS in the UK. She's registered in both Nigeria and the United Kingdom. I would now like to invite her to speak on this topic, DASH diets and blood pressure reduction in adults. Welcome, Abiola. It's good to have you today, and over to you for your presentations. Thank you.
All right, thank you very much for the lovely introduction, and it's lovely to be here. Good afternoon, everybody, and my fellow presenters as well. All right, so I'll go straight to it. So this is the outline that will be guiding my presentation for today. Introduction of the DASH diet, components, benefits, the dietary guidelines, and the conclusion and recommendations. All right, so when we talk about DASH diets, what are we talking about exactly? It means the dietary approaches to stop hypertension. And it's been a long-term thing. Our researchers have shown that it's a dietary pattern to control high blood pressure. And also, when it comes to combating hypertension and other cardiovascular diseases, DASH diet happens to be the one of the options here. Now, it focuses on different components of food. I'm sure if I ask us now that what have you had today, most people will tell me different food items. But when we group those foods into different food groups, then we can easily categorize if you're doing well or if you're not doing well. So it focuses on like increased consumption of vegetables, because vegetables are very good sources of nitrates, and nitrates have a very good control on the blood pressure. Now, overall, the DASH diet focuses on 8 major dietary components. So now I've tried to divide it into like each component into the good parts and the bad parts. Now, for the good parts, DASH diet promotes good intake of the whole grains, the legumes and nuts, dairy and dairy products, and the fruits and vegetables. Then for the other parts, it talks about reduced intake of sodium. Dietitian one mentioned sodium during his presentation. So it talks about reduced intake of sodium, sweetened beverages, red and processed meats, and then the fatty foods. So now going straight into that, when we talk about whole grains, let me put that into very good perspective and context. It means like it contributes, it's like your energy giving food. It contributes like 50% of your overall calorie intake in your diet. So we are talking about things like your rice, we're talking about things like your corn, millet, sorghum, guinea corn, wheat, and the likes. These are foods in their natural forms, and they've not been processed in any way, and they still have like their nutrients intact. They have what we call the dietary fiber intact, because when they undergo any form of processing, then some nutrients will be lost, some dietary fiber will be lost. But when they are still whole, like in their raw form, they have what we call the dietary fiber. Now, the good thing about the dietary fiber is that it helps to mop up excess cholesterol. Dr. Sisoma already mentioned the effects of high blood pressure and all that during his presentation. So this dietary fiber in the whole grains helps to mop up the excess cholesterol. Also, talking about the legumes and nuts, I'm talking about things like the peanut, groundnut, beans, and the likes. They are good sources of what we call the unsaturated fats. Now, we have fat. Of course, fat is a macronutrient that the body requires, but we have the good ones and the bad ones. We have the saturated fats, we have the unsaturated fat. So we promote the consumption of the unsaturated fat. And now legumes and nuts happens to be like one of the good sources. Then also dairy and dairy products. Now I'm putting that it should be the low fat options, because of course dairy is like an animal protein. Animal protein has all the essential amino acids that your body requires. Of course your body requires protein to build up your muscles, to replace worn out tissues and all that. So dairy products, like the low fat options, they have what we call they have the their protein rich foods. So they contribute to the overall health of the heart. Now, again, about the fruits and vegetables, the DASH diet promotes the consumption of fruits and vegetables. The WHO recommends that every day an adult should consume about 400 grams of fruits and vegetables. Now, in your day-to-day activity, it will mean that you have like 5 different portions of fruits and vegetables. So you're not just having like your plain food without any grains, any leafy vegetables. You've not had fruits in days and weeks. No. When you're consuming this regularly and it becomes like a lifestyle, it becomes a part of you, then you're reducing your risks of high blood pressure, or also helping you to control it. Now, to the second part of the DASH diet, which is what we shouldn't have intake of, like reduced consumption. Sodium is a very high culprit when it comes to this, because the thing is, on an average, it is recommended that you have about 2,000 milligrams of sodium per day in your salt, which is the sodium chloride. That's about 5 grams. 5 grams is just about a teaspoon of salt. So because now look at that, like all through the day, you're supposed to have just like 5 grams of salt, just to reduce your risk of having high blood pressure. So it means when you're eating and then you're adding different foods that have added salt, added sugars, you're likely going to exceed your limits for that sodium every day. Now, another thing is sweetened beverages. Usually sweetened beverages, you're supposed to have reduced intake, possibly avoid them. Because they are calorie dense but not nutrient dense. So you're just building up your calories, because everybody has like a recommended dietary allowance every day. So now you can just have a bottle of sweetened beverage, and then you probably meet 1/4, 1/5 of what you require, and you've not added any other nutrients. You still have your micronutrient there, vitamins and minerals. So it's just like you're pumping up on your calories, but not necessarily nutrients. So it's like maybe waste of oral intake, I would say. So, and because he also has, if you're trying to monitor your blood pressure, he also has added sugars, sodium and saturated fat. So it's usually a no-no. The other thing is red and processed meats. These things are usually processed, and when you're processing foods, you tend to preserve them, and sodium is usually used in preserving food items. So it's like you're not taking things fresh. You already have excess salt in them, and when you're cooking, you won't be able to take out all of that salt. So it's usually advised that we have very reduced consumption or possibly avoid it. Then the other thing is fatty foods. I won't dwell much on this because dietitian one already talked about that. Consumption of that will just mean you're increasing your consumption of you're increasing your risk of having the bad cholesterol, and then the good cholesterol will be reduced. Now, going through the different dietary guidelines, I tried to compare the dietary guidelines in the US and also in Nigeria. I noticed that for example, in Nigeria, our food-based dietary guidelines promotes like the different components of the DASH diets, but maybe it was not really classified as DASH diet. But for example, it talks about some key messages from the food-based dietary guidelines. Talks about limiting fat intake from animal foods because they have the saturated fat in them. It talks about limiting the consumption of salt, bouillon cubes, and sugar. Of course, that's another component of the DASH diet. It also talks about consumption of fruits in season. Of course, the DASH diet already promotes the good intake of fruits and vegetables. So now if it's talking about liberal consumption of whatever fruits that are in season, because we have fruits in season, so it's still like the whole idea is that it's still promoting the consumption of DASH diets. But in this context, we're trying to see how it can also improve the heart health. Now in the US as well, their guideline states that it is one of the 3 options when it comes to your healthy diet. So these are things that researchers have shown, studies have shown how much effects they have on the blood pressure. So now, to conclude for today's presentation, when we talk about DASH diet, I'm sure when next you hear about it, you should know that it is the dietary approaches to stop hypertension, and then it is a heart healthy diet because different studies have shown to support how the effects will be on the blood pressure. And also another good thing is that the International Society of Hypertension has recommended the DASH diet as an option when it comes to reducing blood pressure. Also, in conclusion, studies have shown that the DASH diet helps to significantly reduce and protect against the risk of cardiovascular diseases, to which, as we are celebrating the World Hypertension Day today, it is one of the major cardiovascular diseases, especially in our community and in our society. So these diets have shown to have a very strong effect and to also significantly reduce the risk, or better still, maybe to manage and protect against cardiovascular diseases. So thank you very much for listening today. These are some of the references that I used, and I'll hand over back to Dr. Falake. Thank you.
Very much.
Your mic is muted. Okay.
Yes, thank you so very much for the presentation. When I first heard DASH, I thought, dash, comma, all those things, but I didn't realize that DASH is actually dietary approach to stop hypertension. So that's really fantastic. You further emphasized the consumption of certain category of food, including whole foods, legumes and nuts and all of that, and also reducing certain food like sodium, and fats and sugars and all of that. Amazing. Okay, before we continue, I was wondering at this point, I'm seeing some comments in the chat where somebody said it would be nice for this to be, if I get it correctly, the person said they would like for a similar debate, I guess a webinar, to be organized in French, maybe to allow many people to attend. So we understand the language barrier. We are trying, at least this is like a first attempt, to be as inclusive as we can get. So if Dr. Sisoma can help us do a brief summary of the presentation, is it possible before we start debunking the myth, so that it's not too much at a time? If you can take some minutes to just do a quick recap of the summaries from these 3 presentations in French, then we'll continue to ask questions about this myth debunking, if that is fine. Dr. Sisoma.
Yeah, I'm ready.
Okay, thank you.
So I'm going to start with my presentation. Je suis en français, je m'excuse. Alors, bonsoir à tout le monde, à tous les participants. Et voilà, beaucoup de gens ont demandé à ce que les présentations soient expliquées en français. En fait, je suis dans le groupe pour cette raison. Donc, je vais essayer de faire mon mieux pour résumer tout ce qui a été dit. Voilà. Maintenant, je commence par ma présentation. Ça, c'était sur l'hypertension artérielle, proprement dit. Donc, les mots-clés dans ma présentation, sinon les mots-clés, je vais dire dans ma présentation, il s'agit de savoir que l'hypertension est très répandue en Afrique et dans le monde. Donc, en Afrique du Sud du Sahara, on a 30% de la population qui est hypertendue. Et à peu près, dans ces 30%, 27% ne savent pas qu'ils ont même une hypertension artérielle. Alors, les 27% qui se savent hypertendus, seulement 7% des 27% sont contrôlés. C'est-à-dire qu'ils prennent des médicaments et les médicaments permettent de normaliser leur tension. Donc, ça veut dire qu'on a beaucoup de choses à faire. Donc, tous ceux qui ne se savent pas d'abord hypertendus, généralement, c'est lors des AVC ou bien des crises cardiaques ou bien lors de l'insuffisance rénale qu'ils vont savoir qu'ils ont l'hypertension artérielle. Donc, notre objectif, c'est vraiment faire de sorte que ceux qui n'ont pas d'abord d'hypertension artérielle, qu'ils savent comment ils doivent se comporter pour éviter de devenir hypertendus. Maintenant, pour ceux qui sont hypertendus, c'est important qu'ils les sachent tôt pour prendre les médicaments, pour faire les régimes qu'il faut pour contrôler cette hypertension, c'est-à-dire normaliser cette hypertension. Alors, quand on normalise l'hypertension, on se protège contre les complications. Donc, aujourd'hui, franchement, et avec ces systèmes de webinaires, on a la chance d'atteindre beaucoup de personnes sans qu'ils ne soient obligés de partir dans les hôpitaux. Donc, c'est pourquoi qu'on profite pour faire beaucoup de messages de prévention. Donc, en ce moment, Le mot-clé, c'est dépistage de l'hypertension artérielle. Ce matin, j'ai quitté notre CCRF pour faire le lancement, voilà, puisque c'est la journée internationale de l'hypertension artérielle. Dans tous les CCRF de Bamako, il y a le dépistage actuellement qui est en train de se passer. Voilà, et tout le monde voilà, était invité. Donc, c'est ce qui est demandé, même si on n'a pas de signes, puisque plus de 50% des hypertendus sont sans signe. Plus de 50% des hypertendus sont sans signe. Pas de symptômes, pas de céphalée, pas de vertige, rien du tout. Donc, c'est seulement contrôler la tension, même si on n'a rien qui nous permet de savoir qu'on a l'hypertension artérielle, prendre les médicaments, faire les régimes et éviter les complications. Ça, c'est par rapport à mon cas. Maintenant, par rapport au régime, et là-bas, les mots-clés sont là. On parle surtout d'obésité. L'obésité, moi j'ai dit, contrôlez votre tension pour savoir où vous en êtes. Maintenant, les nutritionnistes, diététiciens disent, il faut aller prendre votre poids. Prenez votre poids et votre taille pour savoir l'indice masse corporelle. Donc, 18,5 et 25, et 25, ça c'est poids normal. Maintenant, de 25 à 30, on a un surpoids. De 30 à 40, on a obésité. Donc, au-delà de 40, c'est l'obésité morbide. Donc, prenez votre poids, prenez votre taille, calculez votre IMC. Donc, ça, comme ça, vous allez savoir si vraiment vous êtes obèse ou pas. Donc, ça, c'est par rapport à la nutrition. Donc, par rapport à la consommation des aliments, on demande de consommer moins de sel, de consommer moins de sel, de consommer moins de graisse, de consommer moins d'alcool, etc. Donc, c'est à peu près ces informations. Maintenant, l'objectif, c'est d'agir à temps avant que les complications n'arrivent. Donc, ils disent que c'est maintenant qu'il faut agir avant que voilà, les complications arrivent. Il ne faut pas attendre. Merci beaucoup, docteur Foulake.
Yes.
Voilà, j'ai résumé à peu près
Okay.
ce qui est.
We to everything you have said. Okay, I saw somebody raise hand. We'll take questions as another segment. So please pen down your thoughts on your question or put them in the chat box. In the next segment, we would like to address some common myths that people have about hypertension. So I will just try to ask the speaker whether or not some of these myths, are they myths or are they really something to consider. Okay, to start on that, I would like to ask the question, there's a myth that only the elderly are affected by hypertension. Many believe that high blood pressure is an ailment exclusive to older adults. Is this correct, Dr. Sisoma?
It is not correct, Dr. Fulke. It is not correct. You can be adult, you can have 100-year-old and not have hypertension. But the prevalence increase with age. If you must be hypertensive patient, you can just diagnose it when you are getting old. But it is not the old people that have hypertension. So it is false.
Okay. So
and even more, children can have hypertension. I told before, children can have hypertension from kidney failure, from pheochromocytoma, from Cushing syndrome, etc.
Interesting. Okay, another myth is that absence of symptoms means there is no hypertension. Some individuals assume that they don't have hypertension if they feel fine. So I'm fine, I look healthy and happy. It means that, maybe there is really no hypertension. Is this correct, Dr. Soma?
It is not correct. I said earlier before that more than 50% of hypertensive patients do not know that they are a hypertensive patient. So I myself, I have hypertension, but no symptom no symptom, no headache, no dizziness at all. So you have to check your blood pressure to know that you are hypertensive patient. It is false.
Okay. That's the second myth. All right. The third one, somebody or people actually do some of the opinion that stress is the sole cause of hypertension. A lot of time people will say, "Oh, don't stress yourself," because stress is frequently cited as the primary cause of high blood pressure. Is this correct, Dr. Sisoma?
It's not correct. It is not correct. Stress is a part of the factors. Stress is a part of the factors, not the sole factors. So I talk about lifestyle, smoking, air pollution. I talk about alcohol taking, obesity. What else? So it is not solely stress that can give hypertension. There is even genetic factor. The genetic factor is also frequent.
Okay.
So it is all of the factors that contribute to hypertension.
Hypertension. Okay. So another myth is that if hypertension runs in the family, it is inevitable. There's a belief that if you have a family history of hypertension, it guarantees that one will develop it. Is this something to be worried about? Like my grandmother had it, maybe my mother had it. Does it mean I would necessarily have it?
That's not correct. That's not correct. One of your parents, your father or mother, can be a hypertensive patient. It is not all the children that will develop hypertension. Maybe half of them can develop the disease. The other half will not develop. It depends. It is not a guarantee.
Okay. So and maybe it goes back to the different factors you've talked about, maybe the lifestyle they adopt, the diet they adopt, and all of that. Okay. Another myth is that once blood pressure is controlled, medication can be stopped. Some patients normally would discontinue their medication once the blood pressure normalizes, over time. So as a cardiologist who says, what has been your experience, in this regards?
So it is a big mistake, really, but it is very common. It is very common. Even if we generally we inform the patient that it is lifetime treatment. Usually, when they find a good blood pressure, they decide on themselves to stop the treatment. So thinking that it is over, that's false. So some days later or a month later, the blood pressure will increase later. So I'm really sorry, it is a big mistake, but it is very common.
Interesting. Okay. So my next, I would like to direct to either dietitian 1 or dietitian Abiola now. Some think that using seasoning cubes instead of salt prevents hypertension. It is commonly thought that replacing salt with seasoning cube, like common seasoning cubes, like the common brands that people use, reduces sodium intake. How do you say, like, even some people go ahead to mix multiple bouillon cube from different brands? Um, how would this be a good practice? Dietitian 1.
Okay, so yes, can you hear me?
Yes, please, we can hear you.
Can you hear me?
Yes, we can hear you.
Challenge with bouillon cubes is that there's also sodium in bouillon cubes. So the salt intake is added on when you take these bouillon cubes. It is not replacing the other. You cannot replace bouillon cubes with salt and say that you have not taken sodium. If you take bouillon cubes, you have taken salt. So when you take, it becomes plentifully many much more. It becomes too much. So with the advice we give is that when you do take the bouillon cubes, restrict the salt that you add. Or if you add the salt, then do not add the bouillon cube, because there's MSG, monosodium glutamate, in the other forms of salt that are also in there that are also sodium based, that can increase your risk of getting hypertension. Mixing a bouquet of bouillon cubes may not be the best way to go. We prefer the natural, that you do the spices, the herbs, the seeds, and get yourself going. That is helpful to you. So your basil, your all these vinaigrette and all these garlic, onions, and all these things are helpful. They are the natural and the best way. I prefer women who know how to cook with natural spices than to cook with artificial spices. I once went to somewhere and they asked somebody to fry an egg, and the person took a bouillon cube and put it in the egg while she was frying, and I was very, very surprised.
Okay. Interesting. Okay, so let's talk about herbal remedies. Some people believe herbal remedies alone can cure hypertension. Some people rely solely on traditional herbal treatments for managing high blood pressure. What would be your, it's both medical, herbal is both medical and dietary. So let me allow Dietitian want to still stay. What would be your thoughts to herbal remedy to the cure of hypertension?
So the thing is that herbal remedies, unless they are proved efficacious with scientific research, there in Ghana, there's Mampong, site for herbal medicine production, and they produce top-notch herbal medicines which are being tried. We have trials on them. And now we are having herbal medicines attached to Orthodox hospitals so that they give both of them. But I dare say that the large number will just go to any wayside person and go and buy a bottle of herbs that has not been tested or tried and purport that is a cure for hypertension. That may be dangerous because there are risk of kidney problems when you don't dose these herbal medications and you take them arbitrarily. Then you are at the risk of getting liver and kidney problems. So I would say that you can take herbal medicines only when it is tested and tried and proven efficacious, and there are doses to it, but it is not a replacement for the orthodox medicine. For so many people who will take some herbal medicine, they will need orthodox drugs to also help, because these things have been tried and tested. The side effects are known, and you can rest assured that you will know what to expect when you take them.
Thank you. Thank you very much. This will go to Dr. Sisoma. Some people think hypertension is not a serious health issue. Due to sometimes the fact that people sometimes don't have symptoms, like we said, some often underestimate the severity of hypertension. What would be your thoughts on this?
Sorry for them. Hypertension is a very serious disease. So it is the first cause of cardiovascular disease and mortality in the world. So I myself, I met many patients with complications that include strokes, heart failure, kidney failure, even vision loss, and so on. We put a lesser the mortality. So it is a very serious disease. But not having symptoms does not mean that it is not serious. But many of them will discover their condition during the complication. So it is too late. Sorry.
Doctor said, sorry, it is too late if you are discovering during the complication, and you have mentioned complication can include stroke, heart failure, kidney failure, and all of that. Wow. Another perception is that hypertension is a disease of the wealthy. So some people think that it's only affluent individuals who suffer from hypertension. They often associate the condition with a sedentary lifestyle, like maybe people who are not moving a lot, walking a lot, and also with maybe consumption of rich diets. Okay, let me allow some of our dietitian also. Okay, let me start with Dr. Sisoma. Do you think it's only the rich that have hypertension, or is it anybody that can?
Is anybody. It is anybody. Wealthy or poor people can develop hypertension. That is, that's false. And so even you are wealthy, you can have hypertension. Poor people can have hypertension. So we used to do screening in the remote village of Mali, screening for the population, and we were surprised with the number of hypertensive patients. So in the village, so you can understand that they are poor people. So you are poor or not poor, hypertension can happen to you.
Interesting. Okay. Another is that some people think that hypertension is inevitable with age, that maybe once you reach a certain age, it's just normal or natural for you to have high blood pressure. They think it's a normal part of the aging process, and therefore it's unavoidable. What do you, I mean, being a cardiologist who has practiced a lot, what do you think about this?
True also. Age is a factor, but not all the older people will develop hypertension. No, you can have 100 age 100, you don't have hypertension, and it is not linked surely to the age. You can be old and not have hypertension. So it is false.
It is false. Okay. Another perception is some people think adherence or continued use of hypersensitive management drug may lead to erectile dysfunction or stuff like that. What's your thoughts from a practitioner perspective?
The co-speaker, Dr. Nana Kofi,
Okay.
give the last
Nana, please, do you want to address that?
So the thing with medications is that there are several medications for hypertension, and it is not all of them that lead to erectile dysfunction. Yes,
That
as
was
they heard me loud. So
okay.
please continue.
Okay, thank you. So sorry about that. I like to just take another before we start answering. There are some questions in the chat box, which hopefully now that I was stripped off, I can still have access to them. Okay, which I would like to pull out. But before we get, I will give another 4 minutes thereabouts for Dr. Sisoma to do a recap of this myth debunking, so that the French audience can also better understand that.
Okay, thank you very much, Dr. Folaki. Bonjour encore à tout le monde, tous les participants. Merci d'être venus. Donc, nous venons de finir avec la liste des mythes, des mythes autour de l'hypertension artérielle. Donc, on m'a demandé de résumer un peu ce qu'on a dit sur les mythes autour de l'hypertension artérielle. Donc, je vais commencer par la fin, qui était sur l'impuissance sexuelle ou bien la dysfonction il y en a qui pensent que les médicaments entraînent ça. Donc, notre collègue Nana Kofi a répondu à cette question en disant que c'est quelques médicaments seulement qui peuvent contribuer à une dysfonction érectile, que ce n'est pas tous les médicaments de la tension. Donc, et il a dit aussi que quand tu penses que ton problème érectile de la tension, de repartir voir ton médecin pour qu'il puisse changer ton médicament, pour mettre des médicaments qui ne donnent pas ça comme effet secondaire. Alors, il a dit aussi que prendre les médicaments, éviter l'AVC et l'insuffisance cardiaque et l'insuffisance rénale aussi est plus important que de se soucier seulement du sexe. Alors, du coup, il a dit aussi que l'hypertension artérielle à la longue aussi peut atteindre les artères pour entraîner cette dysfonction sexuelle. Donc, si tu ne continues pas avec ton bon traitement qui ne donne pas ces complications, tu ne peux qu'être perdant. Donc, voilà, là, c'était par rapport à ça. On a dit aussi qu'il y a certains patients, lorsque leur tension est maîtrisée grâce aux médicaments, ils arrêtent le traitement pensant que la maladie est finie. Donc, j'ai répondu que non. Et quelques jours après, la tension va remonter et tu risques de venir avec les complications. Donc, on a dit aussi que la tension est liée seulement à l'âge et que la tension est liée seulement à l'âge. J'ai dit que non, on peut avoir 100 ans voilà, sans faire d'hypertension artérielle. Donc, ce n'est pas tous les sujets âgés qui vont faire l'hypertension artérielle. Donc, on avait dit aussi que le stress était la seule cause aussi. La réponse était non, parce qu'il y a plusieurs facteurs. On a cité les facteurs ensemble. Ils sont le style de vie, l'environnement, la pollution atmosphérique. On a parlé des aspects génétiques et du processus de vieillissement aussi. Bref, c'est que le stress n'est pas la seule cause. Donc, on pense aussi que quand un parent, le papa ou bien la maman est hypertendu, que forcément tous les enfants vont développer l'hypertension artérielle. Voilà, j'ai répondu que non, et que ce n'est pas comme ça. Ce n'est pas tous les enfants qui vont développer l'hypertension artérielle parce qu'un des parents est hypertendu. Donc, on a dit aussi que le sel et les cubes d'assaisonnement. D'autres pensent que quand tu prends les cubes d'assaisonnement, que ça ne fait rien sur la tension. En réalité, la réponse est que les cubes magiques, bien les cubes d'assaisonnement contiennent aussi du sel, comme le sel que vous savez. Donc, ça donne les mêmes choses. Voilà. Donc, d'autres ont dit aussi que puisqu'on ne sent aucun signe, la tension est élevée dans le corps, mais on ne sent aucun signe que, voilà, et ça veut dire qu'ils n'ont pas de tension. Donc, on a répondu que plus de 50% des hypertendus n'ont aucun signe et que malheureusement, la majorité d'entre eux voilà, vont faire des complications. C'est au moment de la complication qu'ils vont être informés de la tension. Voilà, c'est pourquoi on est là en train de former les gens pour qu'ils aillent contrôler leur tension avant. Donc, voilà, peut-être que j'ai oublié d'autres, mais j'ai dit l'essentiel. Merci. Over to you, Dr. Folake.
Thank you so very much. You will all agree with me that this has been quite insightful from the beginning. I've learned a lot myself. We'll spend the remaining time of the call to take some questions. Some questions are in French, so I'll need Dr. Sisoma to help me check the charts and read them. Yes, I mean, people, you need to know, like, this is Dr. Sisoma's first presentation in French. I mean, in English, I mean. And so that's commendable. And he also told us he's self-taught and motivated to learn French. This year, 2025, I will learn French.
You're not alone, Folake. You're not alone.
Yeah, I'm not alone, right? No,
Yeah.
like I see a lot of effort from Francophone to learn English, but I think we just don't make a lot of attempt at all. So it's been really rich. So I will read the ones I can in English.
Okay.
Yeah, I've addressed, somebody mentioned they need to do more of this also in French. So hopefully we'll be able to survive the webinar that is purely French. And now we need English translation so that we get a taste of the pill to know What is I saw a hand raised of Marcel Darcena also. I'll get to that. I'm trying to read out there. So somebody, I hope I get this right. Someone says, thank you for the presentation. More emphasis. How can more emphasis, I think, be placed on mother's diet contribution to hypertension? I believe this is what the question is about. How can maybe I will read out all the questions, then you then see. So that's one on how can mothers diets contribute to hypertension, I guess. I hope that's what the person means. I would like to, okay, that's, I think this person is saying pharmaceutical medication can be the cause of tension, especially sedative. I'm not sure if I got that well. Maybe the person says it causes sedation, maybe it makes people to sleep. I hope I got that correct, but that's the way it's read there.
The drugs called sedatives.
Yeah, yeah. So the one that is Dr. Sesoma solvent or unknown, don't let me massacre that. So I don't run it wrong. So there's a question that says, I know there's Dr. Sesoma solvent or known the qui certain testament. Okay, now I give up.
The same thing. It's a repetition of the question about my friend.
Of the person. Oh, okay. Thank you. Thank you for your presentation. The person says, I have two questions, both to Dr. Sisoma and the nutritionist. Are there nutritional method or behavior to adopt to avoid continual taking medication for high blood pressure? Like, can you use dietary management to control hypertension? Then the second question is it possible to have presentation to keep them handy? Okay, I will address that afterwards. Okay, this another question is okay, that's just a comment. The person is wishing all of us and Dr. Soma happy Hypertension Day. Another person says that we know that pharmaceutical companies will not like to see hypertension related treatments, and they will do everything definitely to prevent from being found. So maybe this person is trying to refer to herbal cure versus pharmaceutical or conventional treatments, I want to believe. So the person is, I think it's just a comment to say we all know that pharmaceutical companies will not like to allow to see hypertension treated, and will do everything possible to prevent a definite cure for hypertension. So those are the key questions. The one that talks about the mother, whether or not there is a nutritional way to undo hypertension without taking medication. Then whether a diet, I don't know whether this person means pregnancy, diet during pregnancy and how it relates to hypertension, but the person is talking about mother's diet and hypertension. So maybe something around hypertension in pregnancy, if you can also cover that. So I'm wondering who is best to address some of these questions.
For like, I think the person is wanting more explanation on the "you are what your mother ate" bit that I presented.
Oh, I see.
Yes. So it's bordering on the fetal origins hypothesis. There's something we call the Bacchus hypothesis, which talks about the mother's nutrition and its effect on the programming of the fetus. So what we are saying is that if the mother during the 9 months of pregnancy, but especially in the first 3 months, where the genetic material is being laid down, you have the person's intake being affected, especially with nausea and vomiting. So the intakes are affected. So they resort to coffee, to soft drinks, to all these snacks and easy energy drinks. And these things are known to offset the genetic expression. And these things are going to affect the person later on in life, in the onset of diabetes, and in the onset of hypertension, in the onset of cardiovascular diseases. There's something called the thrifty genotype, and this thrifty genotype can affect you later on in life. So I think that is why pregnancies must be planned, because many people are usually not aware they are pregnant till after 3 months, and then by which time they would have eaten and drunk alcohol and taken all sorts of things. You are putting not just yourself at risk, but the innocent baby and the child. So Preconception care is important, and careful maternal feeding is important to save us from diseases later on in life. Because I kid you not, the beginning of many of these problems that we have starts from the fetus and the mother's womb, because really you are what your genes express you to be. Later on in life, when you start eating and you are affecting yourself, then it is your own jejereje, as we say it in Ghana.
Whatever didgeridoo means. I mean, we need to understand what
Your
that.
own is your own cup of tea.
Okay. So that we are clear what